Introduce yourself. Who are you and what do you do at Redemption Psychiatry?
Okay. So Dan Friday, I'm the Executive Administrator for Redemption Psychiatry. So essentially I'm in charge of all of the administrative functions, the business side, scheduling, everything to support the clinical staff.
And what has been your experience with TMS so far?
So my experience with psychiatry in general, first, I was kind of new to psychiatry. I had a background in behavioral health, working in different mental health hospitals, worked at the state hospital here and some private hospitals and group homes. And, it was a change to get into psychiatry. When I first came in, it was, we focused on doctors seeing patients, therapists seeing patients, and kind of the traditional medicine where we would do medication management, therapy, group therapy, even animal-assisted therapy. We started doing TMS in 2015 as a practice, which is about the same time that I started. And we had two devices initially. We had one in our Phoenix location, we had one in our Gilbert location. And we only treated, in 2015, from September to December, we might have treated maybe 10, 15 patients. My experience with that was the patients got a really good result. On the business side of it, it was very challenging to get reimbursement for it. So as a procedure, it looked like a difficult thing for us to get reimbursement for. Changes in 2016 and 17, where we saw virtually every major insurance company add TMS to their fee schedule and cover it with significant restrictions. But once we learned how to navigate that, we saw as a procedure, it was the most effective thing that we'd ever done. I remember having patients that we'd see regularly, and we've never had a patient come back in and say, hey, that last medication that you prescribed for me was the game changer, it changed my life. That's never happened. We've seen it over and over again with TMS, where patients come in and they say, I did TMS, I stopped taking all my meds, I'm 100, it's changed my life, I'm better. And we've had patients from 2015 that had that kind of a miraculous recovery and stopped taking all their psych meds or stopped taking their antidepressants, and they haven't taken a medication for 2 years or more than 2 years. So never seen that happen with any other treatment.